everyone, my name is Tazin. I'm a PhD candidate from North Carolina State University, and today I'm going to present on my research studying the associations between animal ownership and child health outcomes in rural Bangladeshi households. This is not moving, sorry. I'm so sorry.
Help. It's not your fault.
Like, if I do this, it's changing here, but not there.
Because here's the mouse now.
Maybe like close the whole thing.
Here we go. Slideshow, Zoom slideshow. Oh yeah, it works. The enter works and both of them. I don't know why it's technical difficulties. Our apologies.
I'm so sorry, but like, it's like this laptop is separate from this. These are not like synced, if that makes any sense. Can I just proceed and start it again?
Oh, like store to a presentation again? Sure.
Yeah. Like if I press the next, this is changing, but...
Save future houses, okay, no. I don't need to save it, so change it.
This is another presentation. Yeah.
So this should be right.
Grab one of the tech support people.
Oh, awesome. Yes, it's working. Okay, I'm just going to continue from the second slide. Despite advances in healthcare, millions of children in low-risk settings remain vulnerable to infectious diseases and growth faltering. In 2021, of 5 million total deaths among children less than 5 years, 700,000 were attributed to acute respiratory infection, or ARI, which was the second largest cause of child death after prematurity. In the same year, 400,000 deaths were attributed to diarrhea. Comorbidity between diarrhea and ARI escalates with increasing disease severity. The possibility of growth faltering also increases from recurring diseases. Fecally contaminated environment expose young children to pathogen. However, these issues have not been fully addressed by conventional WaSH interventions. While the disease prevalence is high in many low and middle income countries, so is animal prevalence in domestic environments. Small-scale domestic animal husbandry offers improved livelihood and access to nutrient-rich food. Domestic animals or pets, however, have been associated with increased risk of diarrhea and respiratory infections. This is a modified F diagram showing human exposure to animal feces and the interventions that can block the transmission pathways from animal to the 5 Fs and from the 5 Fs to the host. Despite growing evidence of zoonotic health risk, there is no standardized metric to quantify animal exposure among young children. Most studies assessing zoonotic health risk from domestic animals to date have used simple indicators such as the presence or number of animal or animal feces near the dwelling. Incomplete measures of animal exposure may yield imprecise or biased results. To bridge these gaps, for this research, our goal was to develop a composite index of animal exposure and assess associations between animal exposure and child diarrhea, acute respiratory infection, and growth in children less than 5 years to investigate how domestic animals contribute to the adverse child health outcomes. This study uses data from WaSH Benefits Bangladesh trial, which collected data from rural villages of central Bangladesh. Data were collected from 5,500 households and households were enrolled with pregnant women and followed the birth cohort of index children. Data were measured in multiple rounds, and we collected almost 20,000 data on child diarrhea, ARI, and negative control outcome, and about 10,000 data on child growth of length for age, weight for height, Z-scores, and stunting, underweight, and wasting. For this study, we developed a composite index incorporating multiple exposure domains of 9 variables. The index included categorical variables for tertiles of number of animals in the compound, number of animal feces in the compound, number of animal feces where the index child plays or sleeps or spends time, number of animal feces behind the house, frequency of animal roaming in the compound, which was never, sometimes, or always, chickens entering the house, same, frequency of primary caregivers hand washing after handling animals or after handling animal feces, and finally, whether the household has a scoop or similar designated tool used to handle animal feces. Individual items were scored from 0 to 3, and maximum possible composite score was 27. The composite score was then divided into tertiles, and we used the bottom tertile as the reference group. We estimated the prevalence ratios for diarrhea, ARI, stunting, underweight, and wasting, and the differences for length for age, weight for age, and weight for height Z-scores. We used generalized linear models and with robust standard errors accounting for cluster randomization and multiple measurements. The adjusted analysis controlled for the following confounders, which was the mother's age and education, number of children less than 18 years in the household, and number of total individuals in the household, and the compound, sex and age of index child, acid-base wealth index, wall material, floor material, and minutes spent to go to primary water source. Now the results. These are the graphs of the mean prevalence of diarrhea, acute respiratory infection, ARI with fever, and bruised by tertiles of animal exposure. To the left, in blue, we have the bottom tertile. In the middle, in yellow, we have the middle tertile, and to the right, in red, we have the top tertile. We can see that children in the bottom tertile of animal exposure appear to have 1.5% higher prevalence of ARI than the higher tertiles and higher prevalence of bruise. And these are the prevalence ratio for the same outcomes as before. Here, we have both the unadjusted and the adjusted analysis. The unadjusted analysis are depicted with the triangular shapes, and the adjusted analysis are depicted with the round shapes. We have the middle tertiles in blue bars, and the top tertile results in the red bars. Bottom tertiles was used as the reference. The dotted line on one means no effect or null association. And here, we can see that no association was found between animal exposure and diarrhea, ARI, or ARI with fever in the adjusted analysis. And lower prevalence of bruising was found in higher tertiles of animal exposure. Next, we have the mean length for age, weight for age, and weight for height Z-scores by tertiles of animal exposure. The colors mean the same thing as before. Here we can see that children in the higher tertiles of animal exposure appear to have lower mean length for age, weight for age, and weight for height. And by the graph, there is a possibility that there was a dose-response relationship. These are the Z-score differences for length for age, and weight for height in the middle and top tertile of animal exposure versus bottom tertile. In the unadjusted analysis, length for age, and weight for height was significantly lower in middle and top tertile compared to the bottom tertile. In the adjusted analysis, weight for age and weight for height was significantly lower in the middle and top tertile compared to the bottom tertile. However, no association between animal exposure and length for age was found after adjusting for confounders. Finally, these are the mean prevalences of stunting, underweight, and wasting by tertiles of animal exposures. Here we can see children in the top tertile had slightly higher prevalence of stunting, underweight, and wasting than those in the other tertiles. These are the prevalence ratio for stunting, underweight, and wasting in the middle and top tertile of animal exposure versus the bottom tertile. In the unadjusted analysis, prevalence of stunting, underweight, and wasting was significantly higher in the middle and top tertile compared to the bottom tertile. However, in the adjusted analysis, no association was found between animal exposure and prevalence of stunting, underweight, and wasting. Now the limitations. Considering this is an observational study, there is possibility that there was confounding despite our adjustment. Some exposures and outcomes were self-reported, so there is possibility of misreporting. However, the exposure index also included objectively observed variables, and the strongest associations were found for objectively measured growth outcomes. The exposure index was generated from existing data, which may have missed other important aspects of domestic animal husbandry, for example, animal enclosures, and no data was collected on child interaction with animals. The strength of this study is that this is a composite index of various types of animal exposures. We had large sample size of almost 20,000 data for diarrhea and ARI, and about 10,000 data for growth. And the study is generalizable to other low and middle income countries where animal exposure is prevalent. In conclusion, no association was found between animal exposure and diarrhea or ARI. Significantly lower weight for age and weight for height in higher tertiles of animal exposure, but no association with length for age or stunting, underweight, and wasting after adjusting for confounders. Children in households with more animals exhibited slightly lower growth, but not to the extent that that could be differentiated from, that could be classified as stunted, underweight, or wasted. Given the absence of association with diarrhea and ARI, but the presence of association with growth, it is plausible that the influence on growth operates through an unmeasured pathway. Further research is warranted to investigate these potential unmeasured pathways. These are my references. And finally, I acknowledge the support of the funders and stakeholders for making this research possible. Thank you so much.
You must have practiced that. That was exactly 10 minutes. We have 5 minutes for questions. And I think I have a microphone, which we need for the remote audience. Any questions?
Great presentation. What did you adjust for in your adjusted analysis?
We adjusted for, I have a slide, let me just go there, just a sec. These are the adjustment variables, so socioeconomic variables basically.
So surrogates for income?
Yes, yes.
Okay. And then you said it might be another pathway you don't understand. Do you have any candidate pathways? Or mechanisms by which this could be occurring?
So currently we're studying antimicrobial resistance. So that's something we're exploring to see if we can find a pattern of something that's occurring in this study area.
Hi, maybe you can introduce yourself.
Hi, my name is Liam. I'm just curious as to, for the part of your slides that was about the weight versus height, why were all of the tertiles below the, why did they all have negative z-scores? I was just curious to hear what that was.
Yes. So, negative z-scores mean the child length is that standard deviation below the World Health Organization's median for their age and sex. So the way we classify stunting or underweight, if it's less than -2, that's like stunting or underweight. So the possible explanation would be in all these cases there was like some deficiency.
Okay, thank you.
I think we have time for one more. Sorry.
Really interesting talk, Drew Cohen from Indiana. I'm just generally curious, like external generalizability, right? Like, so you're talking about instead of looking at specific animals, you're building this composite score. Like, are your methods generalizable to other contexts, other countries where animal exposure might be different, or was that maybe not the intention at all of this work? I'm kind of curious, like, do you see this as moving forward as like a way to measure animal exposure in other settings besides where the study was conducted?
So for this research, we looked at chicken, cows, and goats, so the common domestic husbandry animals. And in those settings, this will be generalizable, but if it's, maybe if it's lamb or something like that, it may not be. But we consider the most common domestic animals that are usually kept for livelihood purposes. Yeah.
Thank you very much. I'm sorry we don't have time. Apologies for the technical challenges, and I'm sorry we don't have more time, but let me invite Emily Ogutu from Emory for the next presentation. And let's hope this works right the first time. Please. 10 minutes for presentation, 5 minutes for questions, okay?
Thank you so much. I'm Emily Ogutu. I work with Emory University. And today I'm going to talk about positive and negative resilience strategies for energy, water, and nutrition amid Kenyan droughts and floods. And this was basically qualitative study. And so just to give a little bit of background, we already know that droughts and floods impact access to clean and reliable energy, safe water, and nutritious food. And these threaten human survival and development. And so there is a need to understand how planning and coping strategies could help inform resilience strategies to support refining interventions to improve resilience. And so with that in mind, our purpose was to explore how communities plan for, cope with, and recover from disturbances by droughts and floods to clean energy, safe water, and food in order to inform development of resilient strategies. And so just to give definitions for planning, coping with, and strategies to have that in mind. So when I talk about planning strategies, I mean actions that communities take before onset of droughts or floods to reduce the risks and prepare communities for potential impacts. And then when I talk about coping strategies, I mean responses and adjustments that communities make during a drought or flood to manage immediate effects and maintain basic needs. And when I mention recovery, I mean activities that communities take after a drought or flood to restore systems and rebuild livelihoods. And finally, when I talk about resilience, I mean the capacity of, to absorb, cope with, or adapt to changing environments while maintaining principal factors or structures, functions, and ideas. And so the main goal of this study was to understand how household resilience strategies, drivers, and barriers were and how they related to access to clean energy, safe water, and food in the event of droughts and floods. And today I'll only discuss about water and food. And so this study was done in Kenya in 5 counties, 2 in arid and semi-arid areas, that is Isiolo and Samburu, and 2 in non-arid and semi-arid areas, that is in Siaya and Bungoma, and 1 in a location which had both arid and semi-arid conditions, that is Homa Bay. And this was based on Kenyan government categorization. And so in each county, we went to 3 communities, and these communities were selected by the county representatives. And then we talked to men and women in these communities who are purposely selected based on their age and also the fact that they resided in those communities. And so we conducted focus group discussions with men and women as well as key informant interviews to understand their perspectives and also their experiences in regard to access to water and food during droughts and floods. And so in terms of findings, I'll present my findings in this order. I will first talk about water, talk about planning strategies, and then coping and recovery strategies. Then I will move to food and talk about planning strategies for food, as well as coping and recovery strategies. So for water, we found that planning before drought and flood was rare, and this was because of lack of awareness on when floods and droughts would occur, as well as lack of resources, as well as lack of ability to prepare at scale in preparedness, in readiness for droughts and floods. And so in terms of planning, these participants said that we do not plan anything for water even if there is drought. They show just supporting the fact that there was no planning before droughts and floods. And then communities depended on traditional warning signs for them to know, for them to plan. And these signs included like studying the wind pattern, and in the Asal regions they talked about slaughtering goats and studying the intestines and the specific patterns that they were looking for in the intestine, something which is interesting and might need more research or work on. And then in terms of preparedness, there are two categories. There are community-related preparedness as well as individual-related preparedness. So for community initiatives, people came together to dig wells, that is women and men dug wells, which they used as communities, as well as they came together and protected the available water resources, so that specifically during floods, so that flood water would not get into their water sources. And then there was also maintenance of community water sources like dams and springs, and this was specifically in Asal communities. And so for individual initiatives, participants talked about storing water, collecting water at night, and sometimes rationing water, as is supported by this quote. And in non-Asal communities, women formed groups where they could collect money and then use the money that they've collected to buy water storage containers, specifically tanks. And then in terms of coping and recovery for water, participants used alternative water sources, including dry riverbeds, where they would go to these places and dig, wait for water to come up before they could collect. And then they would also go to springs and boreholes. And in non-Asal communities specifically, they mentioned about purchasing water from water vendors. Another coping recovery was rainwater harvesting, which was common in both communities, Asal and non-Asal areas, and also water treatment. And this was not common, and only a few people were able to talk about water treatment, and they had reasons like lack of access to water treatment products or other cultural issues which hindered them from treating their water. And also there was prioritization of water use, especially in non-Asal areas where they talked about limiting bathing and laundry, so they could save water for drinking and important uses in quotes. And then they also talked about using stored water just for drinking, and then for other uses they would go to other water sources. And then in terms of community initiatives, participants talked about collecting water in shifts. And this was common from Asal communities, where one community would collect water maybe in the morning, and then another community would collect water in the afternoon. And we found that water collection was basically the role of women and girls, and they showed that all that burden. So in terms of food, participants talked about planning using various ways. For instance, in Asal, they depended on livestock, and in non-Asal, they depended on agriculture, and all these require water. They needed water for nourishing their livestock as well as water for growing their crops. And so they basically did kitchen gardening in Asal and non-Asal communities, as well as in the Asal communities, they sold their livestock, and also in non-Asal communities, they planted drought-resistant crops to ensure food availability in these communities. And then in terms of coping and recovery, participants mentioned sharing food, rationing meals, skipping meals, or using alternative food sources. They also prioritized essential items. They diversified their livelihood as well as relied in government assistance. And so based on this work, we find that most communities lacked adequate planning for drought and relied on reactive strategies due to barriers like resources and other things that I've talked about. And we also find that communities have resilient practices that they already practice, like rainwater harvesting, like growing drought-resistant crops, which could be enhanced to help in terms of addressing issues in terms of access to water and food during droughts and floods. And then we also found that there is a lot of reliance in traditional weather forecasting, and so there is a need of integrating scientific and traditional knowledge, which may then foster more effective anticipatory actions. And finally, women and children are disproportionately affected by water scarcity due to caregiving and resource collection responsibilities. And so any intervention around in this context may want to focus or center women and children in their planning or in their thinking around interventions. And so to that point, I want to thank our donor, as well as women and men who shared their experiences with us, and research assistants who helped us collect data, as well as the county governments from the 5 counties. Questions?
Thanks, Emily. We have about 3 minutes for questions. Does this work at all? Well, use it anyway in case the remote people can hear it. And otherwise we can speak it.
Okay, I'm curious about the stress that you touched on in terms of caregiver stress and with women and children experiencing in terms of water scarcity, and then also just in the fact that extreme weather events are quite stressful. So did you find any examples of like community support or different ways of coping with that stress in these communities?
Thank you so much. I think that was beyond our scope, because we did not ask about what they specifically did for the stress or about the stress that they were going through, although they talked about that in terms of like the distances to the water sources, and then the psychological stress, like thinking about where to go and where to collect water, as well as the tiredness that comes with that distance. But unfortunately, we did not ask about resources that they could use.
Thank you.
Thank you. One more question, if there is one. And otherwise?
Thank you.
Thank you very much. Next presentation is from Alasdair Cohen, and we will start this up. And then would you introduce yourself? Oh, you need to add one thing here. And I lost my mouse again. You see it on the screen?
Oh, no, I can see it. Where do I get my clip?
Yours is on, if you X on this one.
Oop. Okay,
Sweet.
okay, thank you. One of those days. Okay. Okay.
There you go.
Computer's a little slow. There we go. Okay. Hi everybody. Thanks for your patience. Very nice to be here. My name is Alasdair Cohen. I'm at Virginia Tech, and I'm excited to tell you about a prospective cohort study that we did with colleagues at ETSU and many others, and also to share with you where it's going and how we're building on the work. So big picture, just to familiarize you to the region. So this is the Appalachian region of the United States that runs across 13 states covering about 420 counties. This map is from a systematic review meta-analysis study we did a few years ago with the idea to see what primary research has been conducted related to water and water-related health outcomes. This is published if anyone's interested, but one of our high-level findings was of the 85 eligible studies we found, relatively few had been done in the central region, and of all the studies done, relatively few had looked at health outcomes. And for those of you who aren't aware, this is where Virginia Tech is located. So this study that I'm going to share with you today, this was done in 2 counties in central Appalachia. These are our pre-specified protocols, which are on Open Science Framework and published if anyone's interested. This could not have been done without support from a nonprofit faith-based partner, Appalachia Service Project, and a big thanks in particular to a colleague who's here today, Dr. O'Connell, at ETSU, who already had existing relationships with them and helped facilitate that collaboration. So the Appalachia Service Project, their model is to provide assistance to very low-income homes to help with home renovations. And for those households that check the box, yes, you can contact us, that was our pool to reach out to, and we focused on these 2 counties in part because within central Appalachia, these counties on the border with Kentucky and Tennessee are overall relatively low-income counties. So as far as methods, also another shout out, this was my postdoc at the time, Dr. Rashid Usman, who is now faculty at ETSU. And just to give you a sense of just a snapshot of how much work goes into just one round of sampling, prepping sampling containers. So we administered household level surveys. We also collected individual level health outcome data. And then we collected multiple sets of water samples. So an initial draw, which for us is not different from first draw first thing in the morning, which you'd more typically see to look at metals. This was more what we call kind of an exposure sample, just to see what are people typically drinking. Then we'd sterilize the taps, flush them for 5 minutes, and take another set of samples. That way we could help distinguish between contaminants we're seeing that are from the source or from the premise plumbing or both. A number of households also drink bottled water and water from roadside springs, which another colleague, Dr. Komitas, is in the audience and has done a ton of work on that. And so thanks to that knowledge, we set ourselves up to also get samples and look at that as well. And then in addition, with collaborators at EPA, we collected saliva swabs. This first study was kind of a proof of concept just to see what type of willingness there might be within these areas to participate in this way. I should mention, as we mentioned on our consent statements, we didn't, no genetic testing, no testing for drugs, legal, illegal, otherwise, just looking at evidence of potential infection with waterborne pathogens and other related pathogens. And then we shared all the testing, the water testing results back with study households as long as with our nonprofit partner. So what do we find? So we published the baseline results last year. In part, just takes a while to publish things. We were still going, and just kind of, there's, again, relatively little research in this space, so we wanted to get this out sooner than later. Just some high-level things. About 45% of the households have reported incomes of less than $15,000, so really low income, and about 12% don't have full functional plumbing in their households. This is something we adapted from the American Community Survey. And then a couple of households reported having a straight pipe, so not having a septic tank drain field or connected to centralized sewage collection and treatment. So high-level results at baseline, we found so this, it's a longer story I'll happy to discuss in the Q&A. We set this up as a cohort, and we expected a little more balance comparing utility and non-utility households. We ended up with a lot more households on utility water. They were served by 9 different utilities across these 2 counties, so a lot of these utilities are smaller. Good news, utility water looked really good across all rounds. Just one blip for total coliforms, no detections for E. coli. That wasn't the case with households on well and spring water, and so we saw microbiological contaminants and indicators of fecal contamination in a number of households with well water and a lot of the households with spring water. Now the N is really small. Subsequently, we've done another study just focused on, well, 2 studies just focused on households with well water and spring water, and the results have confirmed these initial findings. We also filtered 2-liter samples down. Again, 2 liters with the idea that's about the max you'd expect somebody to drink during the day, to look at a number of different targets, and we found Aeromonas, Campylobacter, and Enterobacter. And as a footnote here, E. coli was not always, it's a good indicator as we know, but it's not a perfect indicator. This is just kind of for fun, and I probably don't have time for this, but so what I'm showing you here is of the 27 households on utility water, this gets at issues of kind of perceptions of water quality and trust and distrust. We asked them as part of it, how many of them drink the tap water versus drink bottled water? And the split was about half-half. And so the big reveal, as far as the underlying tap water quality, we didn't see, at least in this study, in this sample, we didn't see any significant differences. Not to say there aren't legitimate concerns with contaminants and aesthetic contaminants in particular, but this was kind of noteworthy. So as far as the antibody response data from the saliva samples, so of the individuals in study households that were home at the time of our visits, the vast majority consented to provide saliva samples. So here, this is 44 samples at baseline, and the data is broken up in equally spaced bins by age, from 2 years old to 29 and up to 73. A couple points here. One, just to show this is what we would expect, all things being equal, the relationship with age. 2, the positive results for current or historic infections with Cryptosporidium were much higher than we thought. We also collected data on reported diarrhea prevalence, same day or within the past 7 days. In red are the results from the study rounds collapsed across all households, so 10%, 17, 17. Oh wow. And these, for those of you that do this kind of work in LMICs, these numbers are high, and quite high for a high-income country context. Now, we're not saying this is all waterborne in nature. A lot of this is going to be foodborne or other fecal or exposure pathways. That's something we look forward to pulling apart. I'm going to skip through this because this is published, but short version, we did some modeling with the baseline data and saw an association with reported diarrhea and the saliva antibody results. So from the subsequent rounds, part of this study, we also had a nested randomized control trial to provide filters with all 6 of the households on well and spring water. So that's a little caveat here at the bottom, that post-baseline results need to be interpreted with that in mind, because the N was so small also. Part of this was also kind of a recruitment type trial, so we didn't try that hard with the follow-up, just to see how difficult that would be, and it's difficult. So at a high level though, again across 3 rounds, the utility water looked great, which is also why we stopped the cohort study earlier. We didn't see any reason to continue following these households. The results for the households with well and spring water were pretty consistent across rounds, even though the N dropped for rounds 2 and 3. This, I don't have time for, but so here at a high level, this is looking at across study rounds, our antibody results from the saliva for Campylobacter, Cryptosporidium parvum, and Hep E. And the results are kind of nuanced. This is part of why we're still struggling to get our first manuscript together. And we're fine if the results are, hey, it's messy, we're not sure what to make of this. That's probably going to be the conclusion with the smaller N. Subsequently, we've done a larger second randomized control trial pilot with 24 households just on well and spring water, also collecting saliva. So I think we're going to be able to get a better idea of what's going on here. But a couple of things jump out, in particular that if E. coli is detected, we do see an association for some of these antibodies, which mirrors what we found at baseline. Okay, so lastly, just to share some good news, recently our group, we found out a few months ago, we got funding to conduct a large randomized control trial to build on these findings and provide households filters which both address microbials and chemical contaminants and heavy metals. So we're really excited about that. A number of collaborators are here at the conference and in the room, so a lot of work, but we're, if anyone's interested, happy to talk about that as well. And with that, just a big thanks to the many collaborators that helped make this work and put it together, and glad to take any questions. Thank you.
I have requested a new battery, but it hasn't come. I think we have time for one question because we're technically over time. We have one presentation to go. Please stay. Happy hour doesn't start for another 15 minutes, so you're fine. All right.
Thank you. I feel very special to have one question. Great presentation. I have a question if there's anything related to like geospatial analysis, or if those, are they all from the same aquifer? Are they like 3 houses right next to each other using relatively the same groundwater? So just on the wells that are contaminated.
That's, yeah, great question, thank you. So one of the challenges is this region, it's mostly karst topography.
Yeah.
So who the heck knows is the short answer. But that is something that we are planning to look at more closely. And we were actually just discussing this. We had a kind of planning meeting for the new trial, and that's going to be a component, kind of much more of a geospatial focus here. But again, it's small land. So these, also I'd say, just for those not familiar with the area, the counties themselves are really large. So Lee County can take an hour and a half just to drive across it. So, thank you.
And I would recommend to anybody else who would like to ask questions, you know, happy hour, right? Like over here, he'll buy you a beer. Or beverage of choice. All right.
Well, thank you everybody for sticking it out to the end. My name is Tess, Brodie. I'm with the Global Water Center. I'm going to be talking today about insights for rural practitioners on a thematic analysis of implementation challenges in solar-powered water systems. So many of us are familiar with the statistic that 1 in 4 people lack access to safely managed water. But even deeper into that stat, the JMP reported that 60% of those people live in rural areas. And even further analyzing that statistic is that only 25% of those populations actually require new systems, and that 75% of those systems require service improvement. And so at Global Water Center, we really try to target this population. At GWC, we believe that everybody deserves access to safely managed water, yet we recognize that there is a shortage of skilled water technicians, and there remains a significant gap in achieving this goal. That's why Global Water Center focuses on capacity development, technical assistance, and collaboration equipping leaders to create sustainable solutions at scale needed to end the global water crisis. Now, one of the main ways that Global Water Center does capacity development is through developing guides, resources, and courses for the rural water sector. And one of our major courses is around solar power water system design. And we recognize that solar power is a sustainable solution, yet there is a large knowledge gap that exists for practitioners to actually be able to implement these systems successfully. And so we have started, one of our main courses is called Solar Power Water Systems, an Overview of Practices and Principles. And it really acts as an enabling environment, analyzing the enabling environment required for solar power systems to exist. Now this course has been running in person and online, but for this particular analysis, we're going to look at two courses that have ran and look at two different case studies. The first one is going to be from our 2024 and 2025 general course, which was open to people around the world. We had 502 participants in English, and the part of the course is that participants get to engage in an online forum with instructors and with their other people in their cohorts. And so through these discussion groups, we had collected 453 responses that we were able to analyze, and those represent 66 different countries. So that will be our first case study, and our second case study is slightly different. It's from this last year where we provided training to WaSH in Tanzania, which are responsible for rural water supply in the country of Tanzania. So instead of looking at a large global data set, we're actually just focusing in on one country in specific. So within this discussion forum that happens on our online courses, the first module question is, have you installed solar powered water systems in your region? If yes, how has that experience been like for you? And if no, what is there potential for solar power in your region? Why or why not? So this is the question that was posed to our participants. And from this, we really decided that the research question we wanted to explore from this data was, what are common implementation challenges that the participants identified for solar powered water systems? And so using the Braun and Clark method of thematic analysis, which included the steps of familiarizing yourself with the data, coding specific themes that show up, generating those themes, bringing them together and analyzing across the data set, and then defining and linking those themes together, we were able to code and analyze this specific data set. So the themes that were brought up from this specific data set were community ownership and financial challenges, which were around ownership issues, around acceptance issues within the community, and a willingness for people to pay for services. We also saw themes of high initial investment costs being a barrier to implementation, issues around environmental risk and weather dependencies for solar-powered water systems. There's a lot of comments around how rain and cloud stopped the performance of the system. Themes around skills and knowledge gaps of the operators, not having the skills to problem solve or know what to do. We saw themes about technical design, operation, and maintenance limitations, whether that was equipment breaking down prematurely or not having access to spare parts or not having the actual skills to design a system well. Theft and vandalism, and then finally policy and regulation and governance gaps. So for the next part, I want you all to take out your phones, do a quick QR code scan here, and it will bring up a Mentimeter where those themes are all listed, and I want you to rank from your experience, from what your thoughts are, what do you think is the most common challenge out of those 7 themes that we're seeing, and what do you think from number 1 being the most challenge that came up most frequently in the data set, and then down to the least. And again, this is for the general course where we're looking at examples across the globe. So I'll give you a moment to get your thoughts in and rank them, and then I'll reveal the data set to you, and we can explore the results of the Menti at the end. So the results of the general course data set was as follows. We saw that environmental risks and weather dependency was listed as the highest, most common challenge that was mentioned in the data set. Now this is, again, particularly around common themes of rain or clouds that were stopping, low levels of iridescence that were making the systems perform poorly, but there were also cases of storms or lightning strikes that were disabling the systems as well. Next, we see theft and vandalism is very high on the common challenges. Then we get into more community issues around ownership, willingness to pay, and then having actual issues, technical issues with design, with operation and maintenance limitations that were the most common that were shown. Now, I also want to note that it's important to understand the target audience that was taking this course. These were people that were they're technicians, operators, they're engineers, people that are really implementing these projects on the ground. And so, although we all know that things like policy and funding are absolutely key to seeing these programs be successful, the target audience may not have been as aware of those policies, or those are not the common things they're facing in their daily work. So from the second case study that we're going to look at today is specifically for the WaSH course that was hosted in Tanzania. The unique part about this data set is that the discussion forums had happened in regional cohorts, and so the data can actually be regionalized as we look at it. And so there were 5 different zones that were represented in this course, and so we were able to analyze the data of about just over 300 participants across these different regions in Tanzania. So the data set revealed that environmental risks and weather dependencies still remains the top concern and the top challenge of implementers, but what we did see is that it began to shift after that from skills and knowledge gaps and technical operations and maintenance limitations. Now, this is interesting to consider within the context because WaSH is a government agency, and so what we're seeing in the country of Tanzania is that governmental support is in place and systems are in place to actually see these solar-powered systems implemented well. And so the challenges shift from what we saw in the first data set around community-based issues into more of the organizational issues of professionalization of the workforce, and that the WaSH staff would feel like they have the right technical expertise and understanding to actually implement these systems. And so further from that, we were able to break out these issues into regional contexts. And so from this, we were able to see that what issues were more common in specific regions. And these insights allow us to actually provide targeted support to these areas. So for example, the first line of skills and knowledge gaps we saw more significant in the southern and lake regions, that we can provide additional trainings to those regions. In the second line, we see, the central region has a lot of issues around the rainy season. So providing design support to help them build the capacities of the systems to make it through those areas. So I just want to summarize what we found were the top challenges around weather dependency, theft and vandalism, low community ownership, and design and operating and maintenance issues, as well as lack of skilled technicians. As Global Water Center, these types of insights help inform the programs that we do, inform the resources that we provide to the water sector, and we're going to continue to use these types of analytics to help inform and provide better tools to the rural water sector. So if you're interested in any of our resources or online courses, feel free to take a look at some of our resources here. Thank you for sticking around for the last presentation.
Thank you, Tess. We have, just like with our previous presenter, time for one question. So let's make that a good one. Any volunteers?
Thank you for the great presentation. Just, I'm sure the information's on your website, which I'll look up. But for a typical system, if it's pulling groundwater, how long, if there isn't enough sunshine, or if it's Peabody, to recharge better, how long can the pumps continue going?
I mean, that entirely depends on the design of the system. If it has a battery capacity that is built in, then the solar panels will charge the battery throughout the day. So anytime that there's light on the solar panel, the pump can be running. And then when there's no longer light, the pump relies on the battery source to continue to run. So it depends how the systems have been designed. Some are designed with battery power, and others just fill a tank during the day when the light is strong, and then the tank is filled to supply during the times where it's not.
Thank you.
Thank you, Tess. Yes, final round of applause would be great. And thank you again to all our presenters, and of course, to you for being here. Next session on the program, not here, out there. Please go have a look at your colleagues presenting posters. Enjoy a beer or another drink while you do it. It's happy hour. So thank you again, and enjoy the rest of the afternoon.
It's okay if you go. I forgot. I'm like digital. I'm Caroline. Yeah, I was just gonna, you can test on several things. I'm like digital. Don't even worry. I didn't provide us So I'm with the Human Development Fund.
Thank you so much.
Thank you.
Organization, and we're revamping our programming. So yeah, we're like pausing everything, re-meeting. We're in an organization 2 years old, and so bad. And so now I don't teach it. I'm like, we pause on everything and like figure this out.
Yeah, I mean, I like to support a capacity development organization. And yeah.
Is your main focus solar or general?
Right now is to build like a capacity development resources.
Yeah.
Water, the lack of resources, and that's where we're designing that work. Water quality, water quality, marine for so there's a lot of tag right.
Our program specialists is what we have. So maybe if we see your you're fine. And then my we're headquartered in Michigan, Kansas. I'm from New York, and we have an office in Kenya and an office in Atlanta, Georgia. So in our region, and then we're really dependent on way too much. So like that's why like we have 5 months from now. One solution.
Yes. What region? Okay, in Africa, we have Kenya, Nigeria, Ghana. You're from Kenya, okay. Well, our headquarters is in Nairobi, but we also have staff in Marsabit.
He just came from the States.
We also have projects in the Kenyan stuff for Kenya.
I'm Tess. Ken, nice to meet you.
And Emory.
Maureen, yes. Ken from Kenya, that's good. That's
So, regard for the, what is the experience with Appalachia for serious cohort?
Yeah, like large scale systems.
Let's say I want from 5,000 meters per hour from well of 300 meters, 5 kilowatts pumps. Do you have any?
I can't give you specific details. I know like we work supporting Brenfos. Brenfos is one of our partners, and so they, I have full confidence in the technology that's being developed. I think what my experience has seen as we've supported a lot of different implementers is the importance of a good design. And so a lot of times,
Even on solar power.
design, yeah. And you'd be so, I mean, maybe you won't be surprised how many people skip steps and like things are cut, or if like somebody has a budget issue, they say, oh, we have to make it smaller, do this or whatever. That those issues are really what we see cause a lot of failure. So yeah, if you know you're talking about a larger scale system, the solar system has to be scaled appropriately to meet that.
Okay, because most of our systems run on the day solar.
Yeah, so not that, no battery distress.
No. So, but I'm keen to get, I'm really keen to see if there's a technology out there, a backup technology, but that are affordable.
Yeah, it's a struggle right now. But
so that are affordable and can give you maybe even up to 4 hours of pumping.
Yes. And like the other solution is like increasing the storage capacity, right? And so, you know, deciding whether a battery system is better or an extra tank is better. You know, those options are.
The challenge with that is the borehole capacity is limited.
It's limited.
Because you can maybe abstract a maximum, let's say 10,000 liters per hour.
Yeah, but if you hit the limit, then you're right.
So you hit the limits.
It needs to recharge.
Yes, so, but then there's opportunity for small hours of pumping at the same rate. So effectively in East Africa you have around 7 hours of pumping at best, on average. So if I could increase it by even just 4 hours.
Okay, well I should put you in touch with our senior technical advisor is in Kenya. He's worked with Salivary, he's very familiar with a lot of the technologies in that region. He could actually, I couldn't give you the specific answers, but he could. So if you want to connect, I would be happy to pass you around. Yeah.
We've also just formed a partnership with Cohort.
Excellent.
Yes,
That's great.
Sorry, which organization are you?
AMREF, yeah, that's great.
And just from the partnership with Cohort, we are looking at
so we looked at actually
working together in their clean water program.
Excellent. Is that part of the water access project? Program? That's wonderful. Yeah, we love Brodie. They're doing good work. Yeah. Yeah, nice to meet you. I don't have a card. I can't believe I didn't know that. But on LinkedIn is probably the best way to reach me.
Like seriously, that box.
I will give you mine.
Yeah, absolutely.
Thank you.
I got it.
Oh, I do. That was my last one.
You can take a picture of it.
I left the box in my hotel, so I'll have more tomorrow.
Okay.
But let me.
What are you guys doing?
Yes, so I'm with Operation Blessing, and yes, we have an office in Kenya and staff in multiple regions, so we had that connection there. But I really want to reach out to you because we've been looking for more capacity building opportunities for our staff, because we've developed WaSH trainings and things for communities that we do, but we really want to invest in professional development for our staff. And it's just so hard to get everyone in place for anything. So the online courses you have,
They make it really
look like they could really open a door. I saw though under 4 people you have scholarships, so to speak, but then over 4 you'd be looking at a certain pricing.
Yeah. So how it works, and we're kind of like revamping this, but how it's previously worked is that all of our courses have been free and people just apply, and that they apply and then based on their qualifications they can get into the course. We provide funding to us run the courses. What we found is like we have thousands of applications, but we can only run a cohort of 200 people, right? So we've had this massive like interest, but you know, we're kind of trying to spread it across, so like we only let one person in from an organization, so that like, you know.
Yeah, and then they can share the wealth.
Yeah. But at the same time, like you want your whole team, like practically, it's like you want your team to be able to take the course. And so what we've done now is we've shifted to allow for organizations who have the funds for capacity development to actually purchase those seeds and basically fund them themselves.
So that's the thing, we don't currently get budget for, and that's why it's been so hard for me to find something. I'm like giving them all these free resources, and like I'm doing presentations of like of stuff. Operation Blessing. Sorry, I thought that was on here, but it's not.
Yeah, and multiple like reround.
There's a way, I was just opening it, there's a way on LinkedIn where you can like have your digital ID or a digital ID or something like that. And I can't remember how to do that.
Collaborator at Freyland, which is architect.
Operation
That's
Blessing.
also, that's really like, yeah, it's like a WaSH trial, that's great.
Did you say what's that? Perfect.
I think, yeah, like it's not very that way, but it kind of is like.
So,
Yeah, so
okay,
I would be
yeah.
interested in the pricing.
The pricing, well, the cost is $175 per person. Yeah.
Okay.
And the why we have the 4 is just because like it's a lot for us to process all of that, so we're like, our idea is that we want it to be a team, so like at least 4 seats are being
And then
bought.
here's the other thing, time zones.
Well, the courses are all asynchronous, so you can go on and be part of a discussion forum, so it's all text.
Okay.
So all of that can be done whatever time you want.
Nice.
There are like weekly webinars that people can optionally sign into, and those
Okay.
I think they vary the time zones of them so that they can be accessed
But yeah, in our
times of the day.
last.
Great, sounds like you've already thought.
Yeah, it's really designed for
Second time of 24
international
Yeah.
work.
Yeah, this
Right,
is really
so,
exciting because,
yeah, and the
I
course
mean, even 175 is, I mean, that's totally
But for-
reasonable.
That's what I mean. We
compared
make it,
to
yeah, $1,000 or something. Yeah.
college.
Exactly. So the idea is that it's accessible per course.
Person per course, and there are 5 days of courses applied.
Yeah. So and we just have right now we've just had.
You said they're self-paced?
Yeah.
Oh.
But they're yes and no. It's like the course is open for a certain window of time, and they try to keep you going like weekly, and modules are released weekly, so to try to keep you on that. But it's not like you have to sign in at a specific time to do that. So, and we're just in the process of releasing a bunch of new courses. So we have the solar powered ones, but we also just finished one on supply chain management and operation maintenance and risk-based water quality management. So there's lots of great stuff. We have one on groundwater that's coming out soon. So
Do you have, not a detailed curriculum, but like a syllabus
for those, no, I might have them right there actually.
I saw like a mini blurb on a couple of different ones, but I didn't see it.
This is the supply chain one that has like the course description. That's the only one. Yeah, because this is our
So
new
I also
course.
need to figure out, like, do I sign up with my staff so that I know what they're being
I mean,
taught?
I
Because
recommend
I
that.
want to make sure that we're all on the same page, you know.
I recommend it because knowledge, like these courses are great and they provide a lot of knowledge, but the rubber, it's when the rubber meets the road of how are they actually being implemented.
Yes.
And one of our our principles around capacity development is that it's engaging. That's just supply chain. But the website should have more. But we really try to like end the course with some kind of tool. Like you're getting some kind of tool that you can apply to your work. Some kind of spreadsheet or framework or whatever. And so if you're able to attend the course as well, then you can actually help like implement that.
Figure out how that tool applies to us as an organization.
Mm-hmm. Great. Yeah. Mm-hmm. Mm-hmm. Cool. Mm-hmm. Mm-hmm.